Please remember that the insurance is not a value system. It is not tied to morals and ethics or the care of the patient at all. It's a business model. If you are a provider and you are providing care via health insurance, you really don't work for your patients. You work for insurance companies. When we do medicine through a cash-based business model, we then can realign with our value system, which is I am here to help patients achieve the best outcomes possible via whatever means necessary. Hey guys, welcome back to the Nico Misleh podcast. It is I, Nico Misleh here. I got a doozy of a podcast for you today. This is a subject that I'm really passionate about, and especially passionate about it in terms of, I like describing this to providers who maybe just haven't questioned it enough, or maybe they're starting to question their reason into getting into medicine. So let me back up a little bit. Today, I'm going to talk about insurance versus cash-based medical systems or models. Okay. My bias, of course, is that I believe that cash-based medicine is the answer in a lot of ways to what is going on right now in our society and in our culture at large when it comes to healthcare. And I hope that I can provide at least a relatively new and interesting argument for you guys who maybe are still doing a little bit in insurance, or maybe you're fully in the insurance business model and you're just wondering if there's a different way. This is for those of you who are in cash-based systems and maybe you're thinking about going back to insurance. Let me just describe to you how I feel about this, and I hope that we can connect on this a little bit. And I've got some notes here, so if you're watching me and you see me looking down a little bit, it's just because I'm reading off some notes. So first and foremost, I think one of the most important things that we have to register is that the insurance medical system or model is not a value system. Okay, so what I mean by that is insurance isn't tied to like our morals and ethics. A lot of providers get that confused. They believe that, and again, I'm not disparaging anybody who believes this necessarily, but they believe that because the patient is paying these insurance premiums, that it is unethical to not provide care via this insurance system or model. Right? Like, how would we be able to help people if people can't afford to pay cash, pay prices and things of that nature? And we can go on and on into the details of how that's not actually true. This has been proven very well in, like, say, for example, direct primary care clinics. It really has. But please remember that the insurance model is not a value system. It's a business model. Okay. It is not tied to morals and ethics or the care of the patient at all. Okay. So what I'm saying here is insurance is neither good nor bad. This is really important too. Okay. I'm not like disparaging people in the insurance business. Like, they created a really, really clever business model. I might not agree with it, but I'm not disparaging them. It's neither good nor bad. It's not a moral thing. It is simply a model of doing business. So insurance does also not equal, therefore, more legitimacy. And I think this is the culprit in a lot of ways, too, of what patients experience or providers experience. If insurance covers it, it must mean that it's good, right? That's like a moral claim. If insurance does not cover it, it must mean it's not legitimate. It must mean that it might even be bad or like not safe. What's a good example of that? How about instead of me getting labs checked for testosterone, and maybe even my insurance covering that, which a lot of times it doesn't, because I'm feeling depressed or anxious as a male, and we know that testosterone is associated oftentimes with poor mental health, but rather an SSRI is easily prescribed and highly covered by insurance. Now that is more legitimate than the testosterone. Even though the studies do not show in any way, significant way, shape, or form that SSRIs really significantly outcompete testosterone replacement therapy, and we've never really done a good head-to-head there. How about a young female who, I'm talking young female, like teenage, suffering from really severe menstrual cramps, some migraines, and things of that nature around her periods and around her cycles? How about the fact that we dole out birth control, which is essentially a chemical castration for these young women. And again, I'm not disparaging anybody who provides birth control or feels certain ways about birth control, but I'm just simply stating a fact, which is that birth control literally shuts down a female, especially a young female's production of her own endogenous hormones, and instead inserts these non-identical hormones, which are also highly associated with and causative of cancers and clots and strokes, and the list goes on and on. Now, for some reason, progesterone is seen as a non-viable option, not always covered by insurance, not nearly as much as, say, birth control, which is like pennies on the dollar. And so what it creates is this, for both providers and patients, in my humble opinion, it creates a dissociation almost with what is legitimate and what is not. What is morally and ethically right for me to prescribe and provide to my patients, and what is not. And so if insurance denies coverage, what I need you to understand is it is not because of legitimacy. It is simply a business model making a decision that ultimately provides more profit and revenue to the insurance provider. If I'm Anthem Blue Cross and Blue Shield, I would much rather a female patient be prescribed a very cheap and affordable medication like a birth control, an oral birth control, than potentially a slightly more expensive bioidentical progesterone. Do you see what I'm saying? The way the business is set up is to deny coverage, not based on moral and ethical values, is to simply deny coverage to things which are more expensive to those patients because the insurance does not want to spend more than it has to. And we all know that. That's not like news to us, right? We complain about that all the time, patients and providers alike. But you can see where that can get twisted then all of a sudden, because it has this, you kind of just naturally make an association between what is covered and what is not, what is legitimate and what is not. And I think that's disastrous. I really do. I want to highlight another point here, which is that if you are a provider and you are providing care via health insurance, again, I'm not disparaging anybody here. I really don't want you to take away from this whole podcast that I'm like, shitting on you because you're a provider taking insurance. Like, I did the same thing for a long time. Okay. So like, I am one of you. I was in that system for a long time. But what I want you to understand is that you really don't work for your patients if you are providing health insurance. You work for insurance companies. How do you get paid otherwise? I mean, sure, there could be some like copay stuff from patients, whatever. But that's few and far in between, guys. The vast majority of your revenue, your profit, whether you're in a big hospital system or whether you're just owning a private clinic taking insurance, doesn't really matter. You are literally handcuffed to that insurance company. They are paying and footing the bill, so to speak. Does that not also mean that it's the golden handcuffs? Well, absolutely it does. I mean, if you're making $250,000 a year as a psych provider, you're doing hard work, you're working hard, you're seeing lots of patients every single day. I get it. Like, it's hard to step away from something like that. And yet, you have no real authority when it comes to treating your patients as you see fit, because that insurance company can very much dictate how you do that. Number one, the easiest way it can do that is simply by denials. It's going to deny coverage. It's not going to allow you to write for a new medicine that could be much better for your patient. It's going to allow you to write for some crappy old medicine that costs, again, pennies on the dollar. Is that not a barrier to you as a provider? Now, does that not get in the way of your moral and ethical duty to the patient? I think it does. I actually think that, seriously, insurance is probably if we want to talk morals and ethics, again, insurance itself isn't doing this. It's not like some evil cabal, I don't think. I think it's mostly that the way the business is set up, the model, this is just the way the cookie crumbles. You are beholden to the insurance company. You work for the insurance company. They pay your salary. They put your food on the table. They keep the roof over your head. It's not the patients. The patients are kind of like the feeder almost into that system. The insurance is the middleman, right? It gets to dictate all of that stuff. And I think that's the danger. It's the golden handcuffs. It's what creates burnout. Burnout is rarely, I mean, seriously, it's rarely an effect of, working too hard, seeing too many patients. That is a facet of the problem. I'm not denying that. But I know a lot of providers who can work their tails off. Most of you are really hard workers, like unbelievably hard workers. If you're like a nurse and you became a nurse, like you've worked hard your whole life. Same with MDs, PAs, I don't care who you are. You have worked really, really, really hard. You're not shy of hard work. What the problem is when hard work, which you are doing anyways as a provider, it's very draining. I get it. When that is now also misaligned with your moral and ethical judgments. So not only are you working really hard, but morally and ethically, you're in a business model that does not reflect your alignment with your, dare I say, spiritual integrity. We got into this to help people and patients, right? That is the reason why we're in medicine. Why would we do it otherwise? Seriously. At the end of the day, I hope and pray that most of my medical providers, friends, colleagues, etc., most of them got into this because they believe that they were put here on earth by God to do amazing and incredible things for their community, to be healers. Seriously. Like, I would hope you would do this for free. That's how much you freaking love it. Most of us would. Most of us practically do. We're so overworked. The problem is that the misalignment, when that comes into play, all of a sudden now you're working hard to get paid what I think is frankly chump change for the amount of work that you're doing, only to then also feel this burden that you're not actually doing everything that you could be doing for each and every one of your patients, because insurance will get in the way. Whether that's denying coverage, denying a certain medication, a certain procedure, whatever, insurance will find a way to get in the way. And it is not to do that in an evil way. It is simply because that's just the way the cookie crumbles. That's the way the model of the business works. And you have to respect that. You really do. You don't have to like it, but you got to respect it. Because if you're the owner of Anthem Blue Cross and Blue Shield, you're making some good money. So when it comes to cash-based medical systems, and just to be clear, because some people don't know this and it's like no fault of their own. When I say cash-based, I'm not literally saying like all patients do is give me literal green dollar bills. I'm saying cash-based as in there is no insurance. We cut the middleman out. It is not myself, Anthem Blue Cross patient, right? Or what any other insurance provider. It is just me and the patient. That's the transaction. It's not the patient to the insurance company to me. When we cut that middleman out, it might feel like this big, scary thing because that's just what we're used to, right? The narrative in the medical and healthcare community and for you as a patient or you as a provider would be that insurance is necessary to achieve all these things. Insurance is only necessary for extreme cases. Car insurance doesn't cover oil changes. It covers catastrophic events. If you total your car, something that's going to cost thousands and thousands of dollars to repair, you pay insurance for those events. And that is, in my opinion, I think the way insurance would work. I don't think insurance is necessary in many ways for primary care. That should be relatively cheap, $50, $100 a month. Direct primary care model, right? We pay these small monthly fees and we get access to great care and really cheap medications. And by the way, really cheap procedures too. Like, what a win-win, in my humble opinion. The only thing I want to be spending money on insurance-wise is if I end up in a catastrophic event where I need to be flown by helicopter to a hospital and it's going to cost me hundreds of thousands of dollars, maybe even millions, God forbid, who knows what's happening to me. And I don't have to worry because I've paid my insurance premiums for that catastrophic insurance policy. You see what I'm saying here? Like the entire universe around insurance generally works that way. Insurance is not for little itty bitty piddly things. It's for big things. And so the cash-based system, it removes the middleman, which then removes the financial framework, the coverage denials, what you can and can't prescribe, what a patient can or can't do in terms of procedures. It removes that whole barrier. And it opens up something really meaningful, because when we do medicine through a cash-based system, a cash-based business model, we then can realign with our value system, which is I am here to help patients achieve the best outcomes possible via whatever means necessary, whether that's using hormone replacement therapy, whether that is providing my patients with a GLP-1, whether that is providing my patients with a procedure that, again, insurance believes is not warranted, but I know via the research that it is totally warranted and it is best practice to do it now versus later. There are so many different examples that I could give, but again, that's realignment. I dare you to find a provider in comparison. If we stratify the data, let's take all the providers in the entire United States, let alone the world, but let's just focus on the United States. Take all the providers in the United States, mush them up, ask them, are they happier working in a cash-based business, whether they own it or whether they just work within it, than they were working in an insurance model business system? I am telling you, cash based all day, every single day. It's going to be freaking close to 100%. Hell yeah. And there's a reason behind that. Some of these providers might not even be making as much, like dollar per dollar, as they were in an insurance model. But I mean, get this: if you make, let's just say you make $200,000 as a psych provider, but you see 30 patients a day, whatever, 5, 10, maybe 15-minute appointments, follow up, boom, 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 prescribing meds, insurance denials. You got to hire someone to write these, freaking prior authorization stuff all day long. And it's got to go through you at some points. And you have to do that every single day. That's burnout. You're working hard, really, really hard. You have to meet all these different types of charting things so that you can get paid, so that, CMS and all these terrible things aren't going to destroy your whole universe. God forbid you did the wrong thing or typed the wrong thing. I mean, that's a lot of stress weighing on your freaking, not only just your conscious, but your subconscious. And then there's the misalignment. That $200,000 at the end of the day, when you extrapolate that, dude, you're not getting paid that much money. I'm sorry, you're just not. Your quality of life does not even match or come close to, say you made $150,000. We cut you by $50,000. You're making $150,000, but you see 8 patients a day, 30-minute follow-ups, hour-long consultations, hour-long lunch, hour-long. You just get to sit and eat, okay? That's what I do every day. That's what I did when I was in a psych functional medicine model. That's how much I was making. Easy. I had friends making almost twice as much as I was in the insurance model. They were miserable. They worked Monday through Friday, freaking 9 to 5, deal with no-shows, unhappy patients, prior authorizations, and they were misaligned. They were experiencing burnout. And the burnout was not because they weren't good workers or hard workers. They could do that all day. They could. I know they could. The burnout was because ultimately they knew that what they were providing with their patients was not exactly what they would be doing otherwise if they didn't have to, if they weren't even forced to some degree. Do you see what I'm saying? Do you see how big of a difference that is? I was the happiest guy on the block. And I'm telling you what, people don't like that. Your colleagues do not like when you're happier than they are. Your friends don't, your family doesn't. That's a problem. Okay. So it feels very odd because what will happen is sometimes you will be attacked verbally by your peers, blaming you. How dare you take cash from patients? How dare you? They pay all this money for insurance and now you're just robbing them of their hard-earned money. You should be seeing them via insurance. I get it. I get it. I get why they feel that way. I get why they say that. And it's not, I really, my heart goes out to them because I think all of us have been in a position like that before. We have. It's very easy to be jealous and envious of others who are doing much better than us, especially when they're making less money. Like it doesn't make any sense. How's this guy happier than me? But when you are aligned with your mission and purpose and vision, nothing can stop you. You will make great money and you will have the success that you've always hoped and dreamed for as a provider. You will. Because all of a sudden, we're not talking about a misaligned value system in medicine. We're talking about an aligned value system in medicine, which is very hard to do. Very, very hard. So when we're talking about insurance, again, I want to touch on this. Insurance is neither good nor bad. It's rather neutral. It might feel nasty and bad and gross. And I think it is, but hey, it's a business model. It's not here to make moral or ethical decisions. It's here to make money. And for whatever reason, as a society, we went with that. And look where we've ended up. Everything is worse. It really is on the healthcare side of things. It's a crumbling system. And so in my opinion, the great Buckminster Fuller, a wonderful visionary guy who's more on like the architectural side of things. For those of you who don't know, Buckminster Fuller, really cool. He was kind of one of the artists and designers behind like the geodesic domes, those things you might think they're ugly. I kind of do too, but they were back in the 80s. Anyways, he was just a really cool guy. He was a really interesting guy. And he said a quote, and I quote it quite often because it's so valuable, I think. And it goes something like, don't try to fix a broken system. Create a new system that makes the old system obsolete. Fixing insurance, that whole healthcare system is really challenging. And frankly, it is way beyond me as an individual, as Nico Misleh. It is beyond my wants and dreams and desires to even go do that. And fixing a broken system is not easy. And in fact, most of the time, dare I say, it's practically impossible. What would be better, in my opinion, is to create a new system that just simply outcompetes the old system. And I think we're seeing that. I really do. It's not going to be done in 5 years, 10 years. It's going to take many, many, many years. But I do find that the most valuable organic constructions tend to, over time, win out. I really do feel that way. I think we can even see that on like the agricultural side of things, right? It's one thing to try to get the FDA to change, like, hey, please, ban glyphosate and all these things, which, by the way, like, amazing that we're able to get to that point there. So I'm not saying, again, that's not valuable or whatever, but wouldn't it also be great if we could talk to farmers and say, hey, guys, like, can we see if we can come up with a really creative way where we don't have to use these pesticides and herbicides? I know it's a big change. I'm not saying it's going to be easy. I'm not saying it's going to be fun, but my gosh, when you can realign with your purpose as a farmer, you're feeding the country. Literally, the country is existing because you are present and with your knowledge and know-how. And farmers, they're like the most brilliant people in the world. You can't find Good luck finding someone more creative and intuitive than a farmer. I mean, those guys are always coming up with just such novel solutions to things. And you can't tell me that if we didn't put our minds together, we couldn't come up with something better. We have seen that. We've seen many farms transitioning to more organic agricultural practices and things like that. And we might need to start small and grow up. But I'm the eternal optimist. I think those sorts of things are actually something that we can pursue and do. And I think that it starts with us in terms of medicine. Patients love it. They do. If you do it right, and if you stand by your integrity, and if you can align your values and morals with your business in some way, it's just an incredible system. It's absolutely incredible. So please consider, for those of you who have been in that insurance model for a long time, or maybe you're still taking insurance in your current clinic, if you're a clinic owner, sit with that for a second. Just consider, what would it be like if you exited that system? I know there is heartache. Believe me, I've coached quite a few providers who were taking medical insurance to leave, and it was really tough and challenging. But man, when they did it, it was like they were born anew. I mean that. And it sounds really like dramatic and esoteric, but it is. It's like you're a new person. It's not that you're a new person, actually. You get to be the person that you always expected to be as a provider. When you're in college, right, or in grad school for NP or med school, maybe as a doc, remember those feelings of like, gosh, I can't wait to be this type of provider. I'm going to wear my white coat. I'm going to feel really special, and I'm going to help so many people and all that stuff. And you get out, and all of a sudden it's like the exact opposite of that. It's like, this is not fun. This is really hard. I'm working a lot. I don't feel like I'm getting paid enough for the work that I do. My patients are honestly upset and aggravated and annoyed that they can't get the medications or the procedures done that they want to have done or need to have done. Imagine that never happening. Imagine that you just actually roll right into being the provider that you always wanted to be without any handcuffs. You get to call the shots. You get to actually help the people you want to help and create outcomes for them, out of their wildest dreams, because you're not burdened or belabored by anything outside of your own imagination and creativity, frankly. I think that's the art of medicine. What I will tell you is that, and I talk about this a lot. Ray Pete, who again, I call him one of my mentors because he was just such an incredible soul. He said something along the lines of like, art informs science, which for me, that was really hard to wrap my head around. It just felt very esoteric. But what I think he's suggesting there is that as human beings, all of us crave and desire creativity, which in my opinion is the birthplace of art. There's a reason why you get the term art of medicine, not the science of medicine. It's the art of medicine. I think there's something telling there. And I think what it is that even those of us who are literally deep in the sciences, medical providers, right? We're going by data and, peer-reviewed journals and all these different things. And, there's all these different, biological and chemical processes we need to memorize and know so that when we give people medicine, it works, and all these amazing things, right? At the end of the day, we still need to have an outlet for creativity and art. We still need to be able to treat people in a nuanced fashion, to not be so beholden to dogma or to insurance companies. We need freedom. We do. We do not want to be handcuffed by a third-party entity. That takes away the art of medicine. That is why medicine has become an algorithm strictly now. If your blood pressure is this, you give this medicine. If lisinopril starts this, you give that. If your blood pressure goes up, you give this. It's just these algorithms after algorithms after algorithms. As if every single patient is treated as, one is the same as the rest of them. And it's not true. We need more of that back in medicine. And I think simply by going to a cash-based system breeds that creativity and art in such quantities that it's very difficult to even calculate. And I think that patients feel that. I think they see that. Some of my patients, it's funny. I just recently had a patient male patient, who comes to me for testosterone replacement therapy. He saw his primary care, 2 years ago before he came to see me. And he's in his 50s and not feeling very well. And he's tired and fatigued. And he says, Doc, I just don't feel good. I don't feel like myself. And I feel like something's wrong. And, I was Googling about some of my symptoms and wondering what was going on. And, I read some different articles and I saw low testosterone. And Doc, I was just wondering if you'd check a testosterone level for me. And he said, his primary care looks at him. He said, well, why would you want to do that? He said, well, I'm just wondering, if my testosterone comes back low, if maybe that's something I shouldn't address. And his doctor says, well, we can check it, but there's probably not anything we're going to do about it. First of all, the tone of that primary care provider is so wrong. And yet I get it. I can literally put myself in that provider's shoes. I don't care if it's a doc or NP. I really don't. It doesn't matter to me. I can put myself in that provider's shoes and feel the stress, the years of misalignment, the hours worked, the what feels like to some degree kind of nominal pay. The feeling of knowing that even if this guy's testosterone comes back low, there ain't nothing I'm going to do about it anyways. It's not like insurance is going to cover it. And shoot, he didn't learn about any testosterone or TRT stuff. So what's he going to do? He probably thinks it still causes heart attacks, right? Do you see the level of misalignment and ignorance, not in a dangerous, just ignorance, like he doesn't know. Anyways, he begrudgingly checks this patient's testosterone level. Sure enough, it comes back at, 300. Doc says, hey man, it's fine. It's within the range. Don't know what else to tell you. Sounds like you might be depressed. You could try some Zoloft. And the guy says, no way. No way. I know something's wrong here. And 300, look, this is 900 is the highest. This is basically off the limits, off the charts. So anyways, this poor guy finds himself in my office and we do the whole thing, right? Hey, let me describe to you low T and let's get some more labs and really figure stuff out. And we did. And sure enough, of course, we started him on TRT. His thyroid was also terrible. We gave him some thyroid medicine. We optimized all these different things. Guy feels like $1 million. $1 million. He's paying me $225 a month. He has a question. I answer it immediately. Got a problem. I give him a call. He needs a refill. I'm on it. Johnny on the spot. He needs to reschedule. Brittany answers him with a gleaming smile and happy to help. Okay. My receptionist. Now, ironically, I just saw this patient a week ago and we have a great rapport. And he says, Nico, you won't believe the discussion I had with my primary care the other day. And I said, well, tell me about it. He said, Nico, since I've been working with you, I've lost 25 pounds. I've put on muscle. I had a, recent increase in salary at my job because my performance is great. My relationship with my wife, unbelievable. It's the best it's been in decades. The relationship with my kids is better. I'm out golfing again. I hated getting out there golfing. I used to love it. And then I hated it. Now I love it again. My blood pressure's down. I don't use my CPAP anymore because I lost 25 pounds. I've stopped taking my blood pressure medicine. And so I have my yearly physical with my primary care. Remember him? I say, yeah, I remember that whole thing. And he said, well, listen, I go and see him and he's bewildered. He hadn't seen me for a year. And he asked me what I'm doing. And he said, Doc, I started TRT and my life changed. And he asked, who are you doing that with? And he said, well, I don't know if that's any of your business. Why? And he said, well, I think these cash-based clinics are just junk. I think they're just robbing you. How much you pay for that? And he says, well, frankly, I don't think that's any of your business, but I pay this guy good money. He's talking about me. I pay Nico good money. And I said, well, listen, how about I do this? I'll get you your testosterone for $60 from Walgreens. I'll do it for you. And my poor patient, you could just over the video see this guy's jaw just drop, right? Like, what? What? You gaslighted me out of TRT a year ago. You said it was make-believe. And now you're seeing this other guy, Nico, doing all the stuff that you should have done and you could have done, and you didn't. He's getting paid all this money. And out of spite, you want to take business away from him so that you can, I don't know what, not turn $1. It's not like you're going to make anything off of me taking TRT with you. Like, he was so disgusted by the whole thing. And frankly, I was too. I couldn't believe that he said something like that. But I get it. I do get it. I understand it. Because I could imagine being in that guy's shoes, that provider's shoes. I could imagine probably the shame and embarrassment and the guilt, and then turning it around so that I didn't feel that way, right? Because my misalignment, that burnout is so strong that, like, it's no wonder that providers, especially MDs and docs, have the highest suicide rate. It's no wonder, because it's so difficult. It's so difficult to feel those feelings and feel like you can't do anything about it until it's too late almost, or whatever. And, my patient said, he said, this will be the last appointment I spend with you because I really don't like the way you handled this. And so he left. He found another primary care. Again, I just think that was an insightful story into the dangers of these different business models. Again, I'm not saying the insurance model is good or bad, but do you see what it does to us as providers? It takes away, in a lot of ways, our incentive to be the best, to be great, to never stop learning, to never stop achieving, to never stop doing what is best for our patients, because our literal livelihood relies on that. My livelihood does not rely on how many patients I see so I can turn $1 from an insurance carrier. My livelihood relies on me being of unbelievable value and service to others. And I'm not even going to get into, like, you can charge X, Y, or Z. That's a totally different topic of conversation. But my patient says to me, he said, Nico, you're worth every penny. And I would frankly pay you more because of what you have done for my life. It's worth every single penny. And man, if that doesn't make you feel like $1 million, I don't know what will. I mean, just like, that totally made that'll make the rest of my life, basically. I need one patient to say that. Oh my gosh, I'm feeling it right now. Like, I get like goosebumps when I hear that stuff from patients, because I know that I'm aligned. My business and my profession and my model is aligned. And I sleep so well at night knowing that. And I never used to sleep like that when I was in that insurance model, ever. It's hard to even recognize it until you escape it. It's like a bad relationship, right? You're just in it, and you're just in it and in it and in it, and you just keep trying, and it'll be better. Maybe it'll get better, and maybe one day I'll retire. It ain't worth it. You get out of that bad relationship and you get into a good relationship, and all of a sudden you're like, what was I thinking? Right? Like, oh, all those years wasted or whatever. But you can't think of it that way. You just think like, this is the way forward, and I want other people to experience what I'm experiencing, because it's not just for me. It's not. That's the other farcity. Is like we don't need, nice for you to be in cash base, but someone's got to take care of people. It's not true. They say those things to protect themselves. Just like someone in a really bad relationship might protect that relationship. No, I get it. They're trying to be honorable and maybe have some integrity there. But at the end of the day, they're protecting it because they're scared. They're scared of what happens if they don't, if they leave. And God forbid they find something better. So, folks, I hope that, again, I have not hurt anybody's feelings, so to speak. I'm not here to do that. I'm not here to disparage anybody who is in the insurance model right now, who is using that. If you're benefiting, great. By the way, I'm not also saying like you totally can't help people without that, but I just hope that you can see another vantage into the world of cash-based medicine. Because if you've ever considered that, I want you to really, really think about it so that you can pursue things like hormone replacement therapy for patients like my patient did. Don't you want that? Don't you want to experience that? Don't you want everybody to be able to experience something like that? Could you have done it in an insurance model? Well, you could, but do people? No, not really. And again, it's hardly ever the way that it should be done, in my humble opinion. Here's another crazy thing before I wrap up here. I'm going to take a small sip of Sam Pell. Good bubbly water. Here's another thing. Estradiol, bioidentical estradiol that you can get from like Walgreens or say CVS or something like that. Do you know what's in that? Do you know? If you look at the package insert, did you know that there's like Red Lake 40 in there, an artificial dye, titanium dioxide? And like, why are those in there? Like, seriously, why do we need red dye in estradiol or titanium dioxide? Why would we ever need those in a capsule, a pill that you take by mouth? Tell me. So even the products, frankly, that you're getting from a lot of these, quote unquote, through an insurance model, you get it for whatever, dollars on dollars less than you would through me via a compounding pharmacy. Well, even the medicine is tainted, man. I feel like a crazy person, but I'm like, I want my patients, if I'm going to do the right thing, I'm going to freaking do it all the way. When you get estradiol capsules from me and my clinic, we use our compounding pharmacy that doesn't add red artificial dye to their capsules or titanium dioxide or the few other added excipients in there. Because you don't need it, because you're a human being and you literally don't need that. Do you see the incentive that I have to provide you with the best? I want that. I want that for my patients. I morally and ethically feel obligated to do that for my patients. I morally and ethically feel obligated to tell providers who are providing estradiol capsules to their patients with red dye 40 in it, an artificial dye, that they should probably educate them on that. I think that's very reasonable. If you get IV contrast, shouldn't you be educated that the contrast could be harmful to you? Now, I'm not saying it can't have some benefit in maybe some certain situations when we're looking at something, but shouldn't we also tell you that there's some dangerous things in there that could cause some problems? Does every single person out there need red 40? Does it hurt everybody? No. Does it hurt some people? Probably. Shouldn't we just remove that, or at least at the very least give some informed consent? I think so. I really believe that's true, and I'm incentivized to do that because, again, I want to provide the very best outcomes to my patients, and I also have the time to do so. Golly, I freaking love being in a cash-based system, man. I love it, and I want you to love it. And by the way, if you are in a cash-based system and you've had those feelings of like, oh my gosh, I hope I'm doing the right thing, this is really hard, I hope that this episode is also telling you you are doing the right thing. You're doing great. You're doing great. It's not easy, but nothing ever great is. But it's worth it. And you can, because I did, and I'm not special. I'm not. I'm really, really not. I'm not special. But I believe in what I'm doing. And I know that you do too. And when you have a strong belief like that, you're going to be okay. And you're going to find people like me. I can help you. I can guide you. Just like with HRT, right? If you feel not so confident with HRT, let me guide you. Let me help you. Take my course. It's awesome. It's pennies on the dollar. And the fact that if you see 100, if you get 50 to 100 HRT patients in your clinic, I mean, you could be making $100,000 a year in revenue just off of a few hundred patients. You can make probably more than that if you really try hard enough. I do. Again, I'm not special, but I believe in what I'm doing. My patients do too, and they see the value. They really understand that. And if they don't, that's okay. People come around, you know what I mean? They do. And I hope, again, that this was helpful for you. So if you're kind of on the fence and all that stuff, consider just leaning into this a little bit more. Consider learning a little bit more about it, cash-based systems, okay? There's whole communities dedicated to this. Our Facebook group, HRT University Facebook group, which is in the show notes, you can literally hop in there and meet. I mean, there's 1,000 providers in there, and the vast majority of them are small business owners, small clinic owners running cash-based clinics. It's a great community. They're doing all kinds of different things: aesthetics, functional medicine, wellness, direct primary care, you name it. In every state, in almost several countries, right? Not only just in every state, but literally in several countries, they're in that group. Many of them are in the course. So you can hop in there and you can introduce yourself and get a feel for things. Can you connect with different people, right? Come to one of our live events. We're having one of our live events this weekend. It's going to be awesome. And meet some different people and get a sense of what's going on and how can you do this and how can you make it work. Okay. Don't forget, I have a daily email. Please join in the daily email. It's awesome. Free content, free HRT education. I talk a lot of business stuff there too. A lot of things like this. If you love it, again, it's in the show notes. Just opt in, click on the link. You'll get an email Monday through Friday. Just me. I'm just writing to you. And then last but not least, check out hrtuniversity.com. If you're interested in HRT, man, it's the place you want to be. It's the course you want to take so that you can be competent and confident in what you're doing. And you can create amazing amounts of revenue, like insane amounts of revenue with really not that much work, guys. It's not hard. It's wonderful work. Your patients will love you and you'll love them right back. It's great. All right, guys. What else? We got our live event this weekend, which is super exciting. Whenever you're listening to this, it'll be our first live event ever, and I'm just so thrilled about it. Our advanced female course, we're still wrapping all that up. Hope to put that out by the end of the year. And we're also waiting on our accreditation from the ANCC organization so that you can get credit hours. You can't get credit hours for the course right now. It's not officially accredited yet. Doesn't mean you still can't take it and get all the exact same value out of it. But once we're accredited, you have the ability to get CEUs from that. If you buy it now, you won't get those CEUs. We can't retroactively grant those to you. So just know that. But we've priced it a little bit on the, dare I say, low side for you to grab it while it's good, because the price is going to go up because it is that good. Of course, it's that valuable. We've got almost 300 providers who have taken it now, which is insane. We just opened that up. It's only been around for 4 or 5 months. It was the end of April. So what is it? May, June, July, August, beginning of September. So it's basically 4 months old, which is bananas. 300 providers, 300 incredible students from literally all across the United States and around the world. We've got Canada in there. We've got Australia. Shout out to Australia. And it's just going to keep growing, guys. It's just going to get bigger and bigger and badder and badder. So get in while the getting's good. All right, guys, listen, have a great rest of your day. I hope you found this helpful, and I will talk to you next time. Take care.